Hi everyone, my name is Kate O'Connell and today I will be talking to you about the different types of hormonal contraceptives. There are many different methods and it is important to weigh the pros and cons before knowing what method is right for you. In this video, I will be talking about the types of hormonal contraceptives, the side effects of them, and the effectiveness rate and cost. There are two different types of hormonal contraceptives. First, the combined method, and second, the progestin-only method. We are first going to go over the combined method. The combined method works by releasing both estrogen and progestin into the female's body. The three forms of the combined method are the oral contraceptive, the vaginal ring, and the transdermal patch. One of the benefits of the combined method is that the contraceptives are initially more economically feasible than the progestin-only contraceptives. They often have a cheaper upfront deposit than the progestin-only contraceptives. One of the most well-known contraceptives is the oral contraceptive. It is often referred to as the pill and has an effective rate of 99.7% with perfect use. In order to be used perfectly, the pill needs to be taken at the same time every day. Therefore, with typical use, the effectiveness rate drops down to 91%. The pill works by releasing estrogen and progestin into a female's body. One advantage of the pill is that it does not take an invasive procedure to use. Therefore, it can be easily terminated at any time. Another advantage of the pill is that there are multiple brands of the pill, giving users a wide variety to pick from. Therefore, you can try out different types to see what works best for your body and well-being. One disadvantage of the pill is that it leaves a lot of room for human error. Another combined contraceptive method is the transdermal contraceptive patch. It is often referred to as the patch and has an effectiveness rate of 99.7% when used perfectly. However, it has a 91% effectiveness rate with typical use. In order for the patch to be the most effective, it needs to be placed correctly. First, it should be applied onto dry skin. Secondly, it needs to be placed on the abdomen, buttocks, upper torso, or upper outside of the arm. And lastly, it cannot be placed on the breasts. Compared to the pill, the patch leaves less room for human error as it only needs to be applied once every 3 weeks and is removed the 4th week to trigger menstruation. Sometimes the patch can cause irritation of the skin around the application site. Another disadvantage of the patch is that the effectiveness rate decreases for women at larger body weights. According to a study of 3,300 contraceptive patch users, 1/3 of the pregnancies occurred for women who weighed 190 pounds or more. The contraceptive vaginal ring is another great combined hormonal birth control method that has been around for decades. It is often referred to as the ring. Similarly to the pill and patch, the ring has a 99.7% effective rate when used perfectly. However, in typical use, it has a 91% effective rate. It works by releasing hormones into the vagina tissues. The contraceptive vagina ring leaves the least room for human error out of the combined methods, as it only needs to be placed correctly into the vagina once a month. The ring provides birth control without the hassle of remembering to replace a patch or take a pill each day or week. One of the main benefits of the ring is how flexible and small it is. It stretches 54 millimeters wide and 4 millimeters thick. Conversely, one of the side effects that many women have reported about the ring is that it can cause vaginal discomfort or extravaginal discharge. It is also possible for the ring to be spontaneously expelled from a woman's vagina. However, this is not very common. Conversely to the combined method, there are forms of birth control that only release progestin. This can be especially helpful when a woman is not able to take estrogen due to complications in health, such as hyperextension or heart disease. Although these forms of contraceptives are usually a bigger deposit up front, in the long run you will usually end up saving money. The progestin-only methods include the progestin-only pill, the hormonal intrauterine device, the contraceptive implant, and the hormonal injection. The progestin-only pill has very similar side effects and effectiveness rate as the combined oral contraceptive. Therefore, we are going to move on to the intrauterine contraceptive device. Intrauterine contraceptive devices are great birth control options for women that have been around since the mid-1900s. They are often referred to as IUDs. IUDs have an effectiveness rate of 99.7% with perfect use and 91% with typical use. There are two different types of IUDs, the copper IUD and the levonorgestrel releasing IUD. However, the copper IUD is not a hormonal contraceptive, therefore we will not be talking about it. Some advantages of the IUD is that it is inexpensive in the long run. It requires low maintenance as it only needs to be inserted once, leaving little room for human error. It can also reduce cramps and bleeding for some women. And lastly, there are 4 different brands of hormonal IUDs offered in the US that can stay implanted for different lengths of time. Therefore, you can find out which one is right for you. The small T-shaped device is inserted into the vagina by a physician. One disadvantage to the IUD is that this invasive process can be very painful. Additionally, some negative side effects of IUDs include pelvic pain, irregular meshes, infections, excess bleeding, pelvic inflammatory disease, and uterine perforation. Some women even expel their IUD within the first few days of insertion. The hormonal injection is another form of low maintenance and effective progestin-only contraceptive. It has an effectiveness rate of 99.7% when administered perfectly. The injection of progestin is administered into the upper arm or buttocks every 3 months by a physician. One of the main side effects from the hormonal injection is bone density loss. However, this side effect is usually reversible after injections are terminated. Another side effect can be infertility. The injection is so effective that it can cause infertility for up to a year after receiving the injections. The last form of hormonal contraception is the contraceptive implant. Similar to an IUD, the contraceptive implant is an invasive process that creates effective birth control. It is a small plastic rod that is inserted through a sterile needle into the upper arm by a physician. Some advantages of the contraceptive implant is that it is low maintenance as it only needs to be inserted once and can stay in for 3 years. Some disadvantages of the contraceptive implant are that it can cause women to have missed menstrual cycles, prolonged cycles, and can spontaneously dispel out of place. However, that is very rare. Once again, it is very important to consider the positive and negative side effects that each one of these hormonal contraceptives can offer before knowing what is the best option for your sexual and physical health. Thank you so much for listening.